Hi, it's Beth here from International RN, and today we're going to talk to you about the planning station for your OSCE exam. So this is a 40-minute silent written station which will be straight after your assessment. So for this station you'll be expected to do a care plan on the patient you've just assessed. So what do we mean by doing a care plan? Well, it's probably going to be, to be totally honest with you, completely different to anything you've done in real life nursing. It might be similar to something you've done in your nurse training. So you will be presented with some paperwork, which I will bring up on the screen for you. On the front sheet, you're going to have like a brief update on the patient. Please read that, especially if you've got a surgical patient. Sometimes they will give you in the assessment, the patient is pre-op, and on the care plan, they are now post-op. So obviously that's going to change what you're writing about big time. So please read it. And then the next, there's inside of that document, there's also 3 care plans. So you actually only need to complete 2. You will not be given like extra points if you complete 3. So please do not try and do that. Do not stress yourself out and rush doing the last one. It is just if you make an error, there's an extra paper for you. Okay. So we need to select nursing problems. You might have heard them called as nursing diagnosis. So this will be whatever you've seen in your patient when you've done your assessment. So examples of this is things like shortness of breath, pain. If they're pre-op, we're going to do like a pre-op care plan. If you have like the depressed patient with the PHQ, you're going to do depression. If you've had the MUST patient, you can do malnutrition. Okay, those are all good examples. Remember, you need to prioritize and select the most severe problems. So if your patient's got pain 2 out of 10, but you've got a lovely care plan for pain, which you really want to use for your exam, do not do that, okay? Do not. I know it's really tempting to, but you're going to have to skip it and choose something that's more important for the patient. Also on the front, it's going to say the time period for which your care plans should be. So first box is your nursing diagnosis. Okay, so for there, it's always nice to write an evidence in that box. So it would be Peter is experiencing pain, as he stated pain was 8 out of 10. Peter is short of breath, as respirations were 24. Whatever you've had. Okay, now next box is the nursing aim. So for that, we like to use the acronym SMART, which if you haven't heard of, I would suggest you look it up. I really like this one. So it stands for specific, measurable, achievable, relevant and time bound. So this is, instead of just writing any old thing with your care plan, to make it a really good one. Okay, so examples of SMART would be Peter's pain is to reduce from to 6 out of 10 within the next 2 hours. Peter's respirations are going to reduce to 20 within the next 2 hours. Okay, so those are example. If you have the depressed patient, you're going to use your PHQ as your scoring for that. So always, if you have something with numbers, I would recommend to use that like your scorings to suggest ways the patient can improve. So you've got your PHQ, your MUST, your 6 CIT, obviously your OBS, your neuro OBS, those are all giving scores, your pain score. Okay, now after that, you've got your reevaluation date. So that with the acute patient in the hospital is normally going to be 24 hours. If you've got one of the community patients, I normally say like 2 weeks, because you're going to be addressing more long-term issues like the weight loss, which is not going to improve in 24 hours, is it? So I would normally write 24 hours, or if condition changes, the same with the community care patients, 2 weeks, or if condition changes for the re-evaluation. Nursing interventions. Now this is the easy part. This is all those little things we do as a nurse, our day in, day out jobs. You just need to bullet point them of all the things you're going to help, that are going to help your patient with whatever nursing problem you've selected. So for like pain, you're going to administer analgesics, monitor the pain, carry out the pain score, refer them to the doctor, refer to the pain team, provide diversional therapies, all things like this. For shortness of breath, you're going to sit the patient up, check the oxygen's on properly, encourage deep breathing, all of these things. So I would recommend write about 6 of those. Then when you're happy, move on and do your next care plan. Don't waste time writing loads and loads and loads and then have to rush to complete your second care plan. Write like 6, do your next care plan. If you finish that and you're happy with both of them, you've taken a minute to think about it, then you can add in some more points, but don't rush it. And then at the end, obviously, you need to sign and print your name. The reason I'm saying this is not because I think you're idiots, is because I had a few nurses fail because of this. Okay, so that is really important. Some of my previous nurses, they like to sign, put the date as soon as they get to the station, because that gives them time, you know, to clear their head and think of an idea of what they're going to do, because then it doesn't involve too much thinking, writing their name. Okay, and good luck with your exam.